Hi everyone, good afternoon. Welcome to our June monthly collaborative meeting for San Joaquin and Stanislaus. Um, so just getting started with a few housekeeping reminders. Per usual, we are recording this session and we do upload the meeting recordings on YouTube. So if you ever want to go back and reference those, we do have those available. If you could, we would appreciate if you could update your Zoom name just to include the name, your name and the name of your organization, just because it helps everyone, I think, know who our partners are in the room. For our icebreaker question today, we wanted to ask folks how you practice self-care. I know there's a lot happening locally, nationally, globally, and there's a lot we do in terms of work and serving our communities, but sometimes I think what we neglect is ourselves. So hopefully this maybe re-inspires some of us to do something for ourselves today or gives us ideas. So would appreciate if you could put your name, org, and answer the icebreaker question in the chat. And as always, we do hope that this is a collaborative meeting with lots of discussion. So encourage you all to engage in whatever way makes most sense, whether that's through the chat or raising your hand or unmuting. We really want this to be a collaborative space and want to hear from you all. So please definitely let us know as questions or thoughts come up. And I'm not seeing anything in the chat yet, but I think people are going to slowly start putting those in. I see fishing coming up twice, which is very exciting. Um, Sleeping, good food. I can agree with that. Um, Reading, video games, disconnecting, awesome. Hiking, lots of great ideas and lots of outdoor activities. So, encourage you all to continue to put those in the chat. For anyone that's joining us for the first time today, welcome. Our collaborative meetings do happen on a monthly basis, and they're really intended to be a space where we can bring together Medi-Cal transformation stakeholders from both San Joaquin and Stanislaus County to come together to collaborate, identify challenges, and problem solve really with the goal of improving CalAIM implementation and driving utilization. So encourage you to ask questions as you come in. And we also like to hold space. If you are new and would like to unmute and share a brief intro, it's always nice to see who's joining us for the first time. So I will pause if there's anyone that wants to unmute and share a quick intro. Otherwise, we can move on to the next section. No new folks today? Well, that's great to hear. Y'all came back for another meeting. All right, so here is today's agenda. So after welcome and level setting, we will move on to general updates. So we have some policy updates from DHCS that we wanted to cover with you all. Per usual, we'll also hear from the MCPs for any updates they would like to share. We do have two provider spotlights today, specifically focusing on recuperative care. So we'll hear from Gospel Center Rescue Mission as well as Premier Senior Living Management. And they will be sharing with us a little bit more information about their services, how you can connect to them, as well as their referral processes. So encourage you to listen in and engage on that. And then we'll also have space for regional spotlights. So if you were at the in-person, this is where you can share any announcements or successes with the group. And then for today's session, we are going to do breakout rooms as well to encourage a bit more discussion in a smaller space. So we will have two breakout rooms. One is a community supports deep dive for any questions that you may have around the new policy updates, as well as a breakout room focused on resource fair planning as well as in-person events. And then we'll close out with some next steps as well as share more information on the PATH UCLA survey that we sent out to folks last week. For our session objectives today, we have review important statewide DHCS policy updates and resources. We'll also receive important MCP updates and stay informed with peer activities through the provider spotlights as well as the regional spotlights, and also participate in breakout rooms so we can do a deeper dive and discussion on community support updates as well as resource fair planning. So since I have referenced the in-person session quite a bit, we did want to just check in with folks to hear from you around how the in-person session kind of went. I know we got some verbal feedback, which we really appreciate during the meeting, but did want to check in with the group as well. So we will be launching a poll in a sec just to hear from you all on how satisfied you were with the in-person session, just for us to hear how we did and kind of help inform planning for our next in-person session that we're hoping to do in August. So I don't know if we have that poll going yet, but I can do launch that poll real quick. So we'll ask you all to fill that out and give you all a minute just to share how that went. Great to see the responses coming in. I will give folks 30 more seconds if you haven't already filled out the poll, and thank you to everyone who's already filled it out. All right, 5 more seconds. Oh, I see some. Okay, so I'm gonna end the poll and just quickly share those results. It seems like a good majority were either satisfied or very satisfied. And we also had folks that were neutral. So if you were neutral, it would be helpful to hear if you have any feedback for us. And the second part to kind of our poll/question is asking if folks could share in the chat what you liked most about the session or what we could have done better. And this really is intended to help us improve as well as just understand what we should keep and what we're doing well. So I see some folks are putting those in the chat. I see Sarah mentioned spending time. Oh, wait, that's the other question. A bigger room would have been better. I agree. I think it would have made it a little bit easier for us to move around. Networking time. I see Bob loved that. Did not attend. Okay, so that's helpful. Bigger and better location. Not available. So if there are any other thoughts, encourage you all to put those in the chat, and I appreciate folks sharing what they liked or what they thought could be improved. So appreciate that. And we are planning to have our next in-person session in August, but we're working through those logistics. So if you do have suggestions for a bigger room or a spot that would be helpful for us to look into in Stanislaus County, please definitely reach out to me. I would love any suggestions. Okay, so next section, we're going to move on to the DHCS and MCP updates as well as the spotlights. So did want to share another quick reminder about closed loop referrals. I know we've talked about this in a few sessions, but just a reminder that MCPs will be required to implement closed loop referral requirements by July 1 of this year, and they will apply to enhanced care management and community supports service areas. We also wanted to share these resources that you can find in the slide deck as well, that include the links to the webinar that DHCS hosted on closed loop referrals that you can review at a later point, as well as the updated implementation guidance. And they've also released a frequently asked questions that is geared towards for MCPs, providers, and additional stakeholders. as well as the email address that you can contact if you do have questions. And also, we did want to ask if you wanted to put in the chat if there would be interest in doing a more dedicated office hours on closed loop referrals, or if the group is interested in having more opportunity for additional clarification. I know when we've referenced talking about closed loop referrals, it's been pretty high level. So if there is an interest in a more dedicated office hour or more opportunities to talk about this, please feel free to put that in the chat, and we'll definitely take that into consideration as we're planning future sessions and office hours. Also wanted to touch on the governor's budget and the May revise, specifically just to highlight some of the changes for you all, as well as linking to the resources in terms of the revision, as well as the highlights shared from DHCS. So just doing a quick overview of some of those proposed changes. The first is proposing a freeze on Medi-Cal enrollment for individuals aged 19 and older with unsatisfactory immigration status as of January of 2026. Effective January 2027, undocumented adults will be required to pay $100 per month to keep their Medi-Cal coverage, a cost that would not apply to other Medi-Cal members. Cuts to long-term care benefits are also proposed, and potential reductions to other in-home supportive services. And there are also potential changes to housing programs and affordable housing initiatives. The revision is intended to balance the state's budget by making cuts to specific programs while also redirecting funding to other areas. And we did want to note that the revision is still subject to change, just based on changes during the legislative process. So wanted to share that update with you all and some of those changes. Also wanted to share some resources. DHCS has released 2 data sharing authorization guidance toolkits on housing and reentry. This is intended to complement the guidance that they released earlier that focuses specifically on scenarios to help on-the-ground providers and organizations navigate data privacy and data sharing laws and regulations related to Medi-Cal housing supportive services. And these toolkits are intended to clarify when, why, and under what circumstances consent may be needed to share sensitive health and social services information under relevant data sharing laws. And we do have the email address if you do have questions or want to learn more. Also wanted to share this funding opportunity that is open through the Proposition 1 Bond Behavioral Health Continuum Infrastructure Program. They have released requests for applications, and this funding opportunity is intended to address long-standing service gaps by improving access to behavioral health care. And eligible organizations can apply for funding to construct, acquire, or rehabilitate properties that expand behavioral health services for Medi-Cal members and other Californians. So the application instructions are available on their website, and this application is due by the end of October, on October 28th. And did want to share that this is the final round of funding available for this opportunity. And lastly, did also want to share that there is an upcoming webinar that's happening specifically for the TA Marketplace. The TA Marketplace will be hosting a webinar for TA recipients as well as vendors and organizations that are interested in learning more about the marketplace next Tuesday at 1 p.m. And they'll be covering and providing an overview of the marketplace, key policies, as well as how to submit a successful scope of work, and budget, and we'll have a Q&A session. And I see, thank you, Melissa, for dropping the resources as I'm talking about them. But we did also drop the registration link for the webinar if you're interested in attending, and feel free to circulate to anyone that may find that helpful. So at this point, we're going to move on to MCP updates. So I do want to pass it to Niyati if you like to share any updates with the collaborative.
Hello, everybody. Good afternoon. Can everybody hear me all right? Yes, okay. Good to see everyone. Thank you again for joining this wonderful collaborative, and Health Begins for facilitating such a good opportunity for everyone to network and get some updates. My apologies for not joining the last in-person, but I just wanted to share just some updates from our end. Closed loop referral, Navneet, thank you for bringing that up. Health Plan San Joaquin, we're going to be going live with the closed loop referral later in October, probably very, very early in October. The provider services team here at Health Plan of San Joaquin will start working with each set of providers in terms of any changes to the reporting, right? There's going to be a return transmission file change. I think there's going to be some additional fields, so we'll need to make that update and ensure that you have the right templates. So I just wanted to kind of let you all know. Also, for those that are part of Health Plan of San Joaquin, Stanislaus County providers, as you know, CSA is funding Health Plan of San Joaquin providers, ECM and community support with access to HMIS, that Housing Management Information System. So please reach out to Linnell Fuller. I'll drop her email momentarily, but we gave funds to CSA to support our ECM community support providers to get HMIS access. Again, putting the Homeless Management Information System. That's what HMIS stands for. Health Plan San Joaquin also is still open for CalAIM IPP applications. Okay, so we do have an IPP leadership team. So you can outreach to me, and I'll drop my contact information in. You can send in your application. We have a vetting process. We kind of look at your encounters claims to as part of the review, and then of course review your application. This is specific for CalAIM in terms of capacity build, infrastructure build, helping you with navigation through any implementation associated to EHRs that many folks are establishing internally. I also just was looking at some recent metrics in community support services. So I just wanted to kind of share some of the data metrics for health under Health Plan San Joaquin. So we are still, in terms of Q1 2025, we're seeing very, very low usage in short-term post-hospitalization housing, as well as respite services, nursing facility transition to a home. That's been very, very low utilization, as well as the home modification, and of course sobering centers. So just giving you a little bit of color that is in San Joaquin, and similar with Stanislaus County as well. Short-term post-hospitalization is very low. Respite, nursing facility transition to a home also, and then home modifications. The highest utilizers here right now in terms of services is the MTM, the medically supportive food community support. So I just wanted to kind of share that is being the most utilized, along with the housing transition navigation services. So just giving you a little bit of color. Navneet, I don't know if I have a few more minutes, but I just wanted to share, I know many of you that are in process of contracted with Health Plan of San Joaquin. We have a very, sometimes long, a readiness assessment. Again, these are for community support services and enhanced care management providers. We want to make sure that you folks comply with DHCS's regulatory requirements and contractual obligations. It's very important. It's really for your sustainability going forward. So I know that many of you are in process of readiness or baseline. Again, this is typically a desk review. We review the provider's policies and procedures, your system infrastructure, your reporting, because all of that impacts strong delivery of services of ECM and community support. So this falls under our compliance program audit. So I'm just giving you some little bit of color that we're going to be, if you're in that process or having questions about that, that's really looking into your policies and procedures under fraud, waste, and abuse, FWA, your HIPAA, and information security requirements. And typically it's a 60 to 90 day from initial engagement to, but again, remember, I'm just stating 60 to 90 days, but it is contingent upon your submission, your timeliness, your responsiveness, and so forth. So I just wanted to kind of give a little bit of color in terms of that process, because I know we've been receiving a lot of inquiries, and happy to share, if you're hitting any roadblocks. So I'm going to pause here if there's any questions for Health Plan of San Joaquin, and I'll drop in some of the contact information and resources within the chat momentarily. Wonderful, and good to see everyone. Thanks again for being continued support to our members.
Great, thank you, Nancy. So now we'll move on to HealthNet. So I'll pass it to Ileana for any updates.
Hi, everyone. Good afternoon. This is Eliana Argueta, the Regional Program Manager here at HealthNet. Not many updates from HealthNet. I think that Health Begins did a great job just kind of covering some of those topics that have been really in discussion as of recent weeks. I did want to share that HealthNet will be hosting a community baby shower. And Meet, I don't know if you have the flyer available. Essentially, this is a call out for this team. If you're interested in tabling, if you're interested in participating, if you're just interested in attending the baby shower, feel free to reach out to myself or Stephanie. Her contact information is on the flyer. We are doing this in partnership with the West Modesto Community Collaborative. It will be happening next week or 2 weeks from now on the Thursday, the 26th from 10 to 1 p.m. Actually next week already. And again, it's an opportunity for our members to receive just information about, what services are available for those birth equity populations of focus, as well as those moms who may be pregnant or those moms who may have recently had a baby. So some of those postnatal services. We're going to have some raffles. We're going to have some tabling from other organizations as well. So I get an opportunity for this team to either raise any questions or share their interest in tabling at the event. Again, feel free to reach out to me or Stephanie, and her information is listed on the flyer. And is the flyer in the deck, Nandi?
Yeah, we dropped it in the chat. So
Oh, perfect.
It was on our
Perfect.
Google Drive, and we can also circulate it in our email as well. But you should be able to click on the
Oh,
flyer.
perfect. Yep, I think I can.
Awesome.
Great.
Cool. So I know KP shared that they don't have any updates for this meeting. So we did want to move to our provider spotlights. So I will now pass it to Sandra from Gospel Center Rescue Mission.
Good afternoon. Like she said, my name is Sandra Maple Deaver. I'm the Recuperative Care Director at the Gospel Center Rescue Mission. So I was told some people wanted to hear from Recuperative Care. So we are a faith-based organization. The Gospel Center Rescue Mission is ministry to the people of San Joaquin County, where the homeless and addicted in our community are presented the opportunity for spiritual, physical, emotional, restoration, and equitable inclusion through the love of Jesus Christ. We are non-denominational, and that doesn't mean that you have to be religious to we are open doors to everybody. So as you can see, my contact information is on there, our website for the Gospel Center Rescue Mission, which if you go to that website, it will give you a brief description of all the other programs besides just recuperative care at our facilities. We have clothing closet, we have life change programs, we have a lot of different opportunities for individuals here. So I was just given some key points to kind of some questions. And so one of a success to us is the networking and agency partnerships. The many agencies are able to collaborate and bring services to clients that we were not able to be accessed before. So I believe that a lot of the CalAIM initiatives have really brought a lot of help and support and resources across the board that just before a lot of us agencies wouldn't have collaborated together. So with recuperative care here at the Gospel, we do both Stanislaus and San Joaquin counties. So we currently are contracted for recuperative care, short-term post-hospitalization, housing navigation, and day rehabilitation. Those are we are community support services. So some of the challenges that we came across are constant changes with authorizations and billing, ICD-10 codes being accepted for authorizations, but being rejected for billing claims, keeping up with the changes implemented by DHCS and managed care plans. So it's sometimes it's just a little bit of a challenge, but I will have to say that these meetings do help with a lot of that. The managed care plans do try to keep us informed of what's coming up. Can you go to the next slide? Are you able to switch slides for me, or is this the only one you put up there?
Oh, I think Navneet might have lost internet connection. I
Okay.
see she got kicked out. Give me one
I can
sec.
read what my other slides say for now. I have them. If she's not able to put them up. So what is the referral process? So normally the referring agency would reach out via text or message for bed availability, and then they would fax a referral to the number listed on the referral form. If a lot of agencies already have our referral form, if not, you can reach out to me through my email and I can send you a copy of that. We respond to the referring agency within 24 hours or 1 business day. Recuperative care staff then reaches out to referral contact listed on the referral and we discuss any concerns. Then the recuperative care staff will do an in-person assessment with the individual being referred, at which time they will make acceptance or denial determination. And that's when a lot of people joke, we have what we call the golden ticket. That's the acceptance form. So a lot of times they're asking us like, do we get the golden ticket? That means that the person is accepted and they will be coming to the Gospel to be in recuperative care services. Next. Sorry, I'm trying to go fast. I was told I have like 5 minutes, so you guys have 2 minutes of. So some of the pain points are ensuring we're keeping with the guidelines of DHCS standards and they're constant changing to make sure that we meet those changes. We choose to be more hands-on with our clients than statistics and electronic records. So recently we're finding out that we're supposed to be tracking a lot more information than we actually were. So we're trying to find the fine line between those two things. We do understand that stats help to improve the programs, yet we cannot track stats for every agency that is involved with each individual client using their database. So we have a lot of places that want us to utilize their database, but there's so many of them, you know, it's kind of hard to find out which one kind of helps us with all of it. So finding a universal database for agencies to communicate has been a huge challenge. Everyone wants you to contract with their database. So successes, we've had quite a success in getting people transitioned to something better than back on the streets. Whether that be with family life change program, emergency lodging, own place, sober living, etc. If an individual is able to manage setting and keeping their appointments, set up transportation through the managed care plan, connect with their ECM provider, manage refilling their medications with the pharmacy, and other daily independent tasks that were not manageable to them prior to being admitted to recuperative care, then those are successes to us. They may be small, but they all contribute to the reasons they struggle with their health issues. So best practices, we feel like you need to get to know your clients. Most of these individuals are used to being let down or falling through the cracks. They begin to get back on their feet and start feeling better. This is the point that we really need to stay engaged and work towards a better outcome for the individual. We need them to know we are sincere in our approach to helping them before they make the decision to leave and go back to the street. And last but not least, this is just our client eligibility process, admission criteria. A person has to be identified acute illness or exacerbation of chronic illness. Recuperative care stays approximately 30 days. There's some new standards going out there that we understand that between recuperative care and short-term post-hospitalization, it's only going to be about a 6-month period. It's going to be allowed now. So we have to juggle the difference between those two. They have to be non-contagious. This is a shelter group living environment. No isolation or single rooms are available. Able to safely and independently perform all activities of daily living. There is a minimal supervision, no medical care on site. We do have a clinic on site, and we do have San Joaquin mobile clinic that comes twice a week. Those are amazing. Able to function in a group living environment that is drug and alcohol free. Clients may not leave campus except for medical and social service appointments. We go to bedside to meet referred individual in person in order to be assessed for eligibility upon initial evaluation of documentation received with referral. And that's really a meet and greet. It's not only for us, but it's beneficial for the client because we have a lot better no-show rate with that. The clients feel a little more familiarity, especially if they've never been here before. So they have a tendency to actually show up and not just be like, I don't know where I'm going. I don't know who these people are. So that's one of the reasons why we do. And then that also is our outreach to the individual. So I think that's the last slide, correct?
I believe so.
Sorry if I sped read that, but I was trying to stay kind of within.
Appreciate that. I know that there was a question in the chat from Lisa. If you could provide guidelines for referrals, who's the population of focus, and what kind of documentation is needed for a referral? Not
Okay, so if you leave your email address, I'll make sure on the referral it actually states, usually it says the H&P, but I don't want the whole history. So our population that we focus mostly on is for inpatient admitted to the hospital that are being discharged, and that they don't meet criteria for skilled nursing, but to go back on the street, they're just going to turn around and be right back in the hospital again. So like we said, they have to have an acute illness, new onset acute illness, or exacerbation of chronic. And so I'm not sure what Eliana put on there, but I can send you my referral form, and on it, it just kind of tells you the documentation. Usually what I really want is from that admission in the hospital, I would like to see what their chief complaint of going into the hospital for, and then what is their most recent progress notes, because then that gives us kind of an idea of what's going on with the individual. Maybe they found something else while they were in the hospital, and that's why they're being referred to us. But I really need to know why they were admitted and what their status being discharged is going to look like. Like what is their progress, and what is the doctor suggesting during their discharge.
Were there any other questions?
I see so we are San Joaquin and Stanislaus County, but we're only a CS provider.
Awesome. All right. Thank you so much, Sandra. Appreciate the presentation and the overview.
Thank you.
Okay, so next we'll move on to our next provider spotlight, Premier Senior Living Management. So I believe I'm passing that to Christine and Shelley.
Hi, I'm Christine. I'm going to start off. Shelly and I are going to tag team this. So we are Premier Senior Living Management. We own and operate 3 facilities out in the Sacramento and San Joaquin Valley. One in Sacramento, the other in Lodi, and the other in Tracy. We are licensed for 375 beds, and our primary focus is the elderly community. We do focus on multiple chronic conditions like diabetes, COPD, mental illness such as dementia, Alzheimer's, schizophrenia, just to name a few. We do help with the homeless solution in those communities. We do accept pay from ALW, private pay, VA, insurance, or any of the Medi-Cal members. We also accept hospice. Once these individuals move into our facility, we assign care managers to them and we connect them so that they get the proper services within our facility. We are really different from other assisted living facilities where we do focus on creating small groups so we can provide that full level of care, which is focusing on their needs, such as activities of daily living, medical management, and also a really large program which is called Life Enrichment, which includes their socialization inside and outside of the community. We also really focus on trying to be the solutions for the long-term housing, respite care, and recuperative care. Our goal is to become a CalAIM provider and to work in collaboration with you all and the insurance companies, and provide that whole person care. I'm gonna pass on the processes, the steps that we take to bring in a resident into our facility, and I'm gonna send that over to Shelly to talk more about that. Shelly, are you there? Okay.
Oh, there you go. Can you guys hear me? There you go. So I'm going to go over real quick. We call it 5-step admission process to just kind of help you guys understand how we look at, I call them patient transitioning to residents for us. So typically one of our focus has been working a lot with SNF through the SNF diversion to assisted living focus. And so we typically look at the residence criteria. Are they on Medi-Cal? Do they have Social Security? What are their condition? Is it a condition that we can support? Because as Christine mentioned, we don't provide medical services, but we do have support from home health and hospice. We typically prefer to look at residents that have been in a SNF for about 60 days. And then we look to see who are the responsible parties and payees. So those are some of the general information that we try to collect from you. So if anybody, for example, anybody on this call ends up calling our ED or our public relation director, these are some of the questions that they will be asking you to understand what is this resident's health profile as well as their financial profile. Once we've identified that the resident meet our criteria, we then, or you've identified that it could be done by you, if they kind of check off some of these boxes, we will recommend you reach out to either our public relation director or one of our community executive director. And from there, they will step in and do like an assessment, both a medical and financial assessment for the residents so that we have a game plan in how we will be taking care of them on the from a medical perspective, and or their ADLs basically. If they have any medical needs, how we can bring other medical partners on board, and then looking at their financial eligibility, whether we can get them into the ALWP program, whether we're going to be working with an insurance carrier to transition them into a plan, or what we'll do a combination between maybe a private pay that will eventually transition them into one of the plans. So we try to work with the family. Our team tries to identify what that strategy looks like. And then from there, they get into tours / signing the admission agreement, and they get to move in. So the process can range anywhere from a week, depending on how far along they are and how much information they have, to maybe even a 2-3 months process, because it might be our public relation director working with your team, someone from your organization, so that we can get these resident criteria information checked off on our end. So this is just a very general summary of how you can get someone in. So let's go ahead and move on to the next slide. So I really wanted to highlight the success for us, which is what we call our WP project that just occurred back in end of April, first week of May. We were asked to help a SNF transition 29 patients into our community. We did this in a week-and-a-half process, which was super crazy. But it was a great experience, because this is exactly when we talk about that diversion plan. This is exactly what we're referring to. And so we took these residents, our team went out there, spent about 2-3 days assessing, understanding the residents, figuring out which community works best for them, working with their families, coordinating transportations, and working with the doctors and letting them know where they're all going to. So we also worked with a CSA that helped us do the transition as well. And so this was a great project, but it was definitely a project to help us all understand that this is where I think what we're intending to do moving forward. So definitely there were a lot of challenges, being that it was such a short time frame. Due to the shortness of the time frame, I think we had a lot of people. There was a lot of people involved, a lot of hands in the pie, trying to piece things up. So I think hopefully moving forward with the longer time frame will be better. But I think this is definitely a success story that we can continue to refine and build upon moving forward to the future. So I don't know, Christine, if you want to add anything to this.
Yes, absolutely. So one of the lessons that we learned, which is great, is that we have a really strong corporate team that supports processes such as this. We were able to meet the requirements and the documentation needed for the health plans. We're still currently working on getting some of the residents set up on SSI and the proper funding to pay the facilities, but we are moving in that direction, and it's something that we really want to pave the way and create something better for other assisted living facilities to follow. So we love working in collaboration with you guys, learning from you all and how to make this process better, but really working on getting the funding in and turning us into the providers so that we can support this as a whole patient care, and move in the direction of like positive interaction with our residents so that they don't have to go anywhere, and we become the solution for some of these elderly residents that are experiencing homelessness.
So if you want to jump onto the last slide. So I just wanted to mention quickly here, so that all of you know the communities that we're currently managing and operating. And these are the key people, the executive directors at each of the community. Amanda is a public relation director that oversees, that works in all the communities. So if you have someone, a client that may not be 100% ready right now, and you want to start the process, Amanda will be the contact person that you'll be reaching out to. So Amanda can help you get things situated, so that client meets all those criteria that we talked about. If you have someone that is already on some form of medical insurance plan, they have Social Security, maybe they're in a SNF, they're getting ready to move out. I would say definitely identify the community that is most appropriate in terms of geographic location or the services that they provide. Each of our community has a little bit of a specialty. So these will be the people that you'll be reaching out to that you can work directly with to start that process and that conversation to see if they will be a good fit for our community. And I just wanted to point it out right now, our community, obviously we're in Sacramento, we go out to Tracy. We are working on expanding our geographic region as well as the number of facilities that we are operating and serving. So please continue to connect with us. And so that as we continue to grow, you'll better understand our the geographic location that we cover. We want to really, this is really, Christine and I are very new into working with the team. So the CalAIM group, I call it. So we want to continue to better understand how we can collaborate together. And I think that that's our intention. So I don't know if anybody has any questions that we can address or answer. I think the one comment I do want to make is I think we highlighted the WP project, which we moved a group of 29 people within that 2 week from one SNF over to all of our community. We do individual ones, which we've been doing for a long time. I just wanted to highlight that because I know that sometimes, there's larger facilities that are either changing licensing or closing down or needed to transition. So that was sort of the situation in there, but we do work on one-on-one cases. And so that's why I think it's great it's best to be able to contact one of the 4 individuals that I've listed. And so that we can work with you individually to see what is the right community and how we can bring them on board. So.
Okay. Thank you so much, Shelley and Christine. Really appreciated hearing from you both. So we did want to hold some space for any regional spotlights. So if any folks want to just unmute and share any updates or announcements on any meetings or events that you may be having or any successes that you wanted to highlight with us, this is your opportunity. You can also put them in the chat if you aren't able to unmute.
I have a question.
Sure.
Okay, so my question is, I didn't know, and I kind of found out last week, it would be for the health plans for HealthNet and Health Plan of San Joaquin. There was an update on the submissions for HTNS and housing deposit, and that they're not going to be able to be ran concurrently, but if a person is on ECM, they automatically qualify for CS. Is there any way that they can elaborate on that a little bit more?
Yeah, if Niyati or Ileana are still on.
Yeah. Hi, this is Eliana. Can you repeat that again, Josephine?
Yeah. I didn't know that DHCS had changed some of the policy guidelines. And so going over it, and I found out through trial and error because I had a submission that went through, but DHCS says that HTNS is no longer a requirement when submitting for H0044. And if a person automatically qualifies for ECM, they should be connected to CS automatically.
Are you reading an official notice?
Yeah, it came out in volume 2.
So the 2 services that are not able to be ran concurrently, right? Because they're completely different, are navigation and tenancy.
Correct.
Right. So are those the 2 you're referring to?
Correct. So that one changed. It said it was updated April 2025, which HealthNet runs different than Health Plan.
Mm-hmm.
So for HealthNet, we generally have to put in HTNS, and then we can't run concurrent with H0044. So we submit the submissions differently. So maybe
That's
it's a
correct.
question for, we
Yeah,
have to wait
because
until the H0043 automatically all the way runs out. But it's saying now that we don't have to run for HTNS. Is that the H0044 will automatically qualify them for HTNS? So are we still running it normally, or are we just requesting for the H0044?
when you say running it
For
normally, is that like
authorization, I'm
submitting an
sorry.
authorization? Okay.
Yes.
So it sounds like you have a very specific answer, a question that I may not have a very specific answer to, but I'll give a
Okay.
general answer. So that's right. So housing navigation services cannot run concurrently with tenancy, right? Because they're two different scenarios for the member. One, they're navigating and looking for housing. The second
Mhm.
part of it is they're already in housing. So that is correct. And your second part to that was if they're receiving ACM, they're automatically approved for CS. Was that the question, or what the notice
Yeah,
is
that's what it
reflecting?
says in there. So it's basic, when you're reading it, it's kind of bland. So I'm just asking, is the requirement still that we need to submit the authorization? Because how I'm reading
Yes.
it, okay,
There's always gonna for community support outside of sobering center, right? That's at least for HealthNet. That is the only service that does not require an authorization. You will have to submit an authorization for either housing navigation or tenancy when the member's ready for either pathway, even
okay,
if they're receiving ACM services.
okay.
But I'm assuming you're referring to volume 2, right, of the new policy guide.
Yeah, there was like a whole bunch of changes and some of it's,
Okay. For volume 2, those services should go live, at least for HealthNet. We will be updating our authorization guides that are available on our website by July 1st.
okay,
And so if any changes come from that, they will be updated again on those authorization guides. But Josephine, if you have any particular questions or you're seeing any denials or anything like that, feel free to reach out. And then we can get together with the internal point of contacts just to, ensure that we're giving the right information and the right pathway for those authorizations.
okay. Thank you, Eliana.
And Josephine, this is Niyati. What I would recommend also, if there's any ongoing questions or anything of that, feel free to contact your provider services rep. Are you aware of who that is? Because they will direct it to the appropriate department to kind of give you guidance, because that would probably be the utilization management team here at Health Plan.
Awesome, thank you.
You're welcome.
I'll add that one of the new changes, right, for ECM as it relates to community supports is with transitional rent. So if a member is eligible for transitional rent, which most of the MCPs, I believe, go live next year, there is almost like a mandatory enrollment or authorization for CS services. But that's a little bit different than if a member is just enrolled in other ECM populations of focus. So maybe we need to dissect that a little bit more.
I was on mute, thank you.
Thank you. Appreciate that live troubleshooting. Okay, so we're gonna move on to the next section just for the sake of time, and so we don't keep you all here longer than you want to be. So we're gonna move to our breakout room discussion. So I'll just provide a quick overview of the breakout rooms as well as kind of what to expect, and then folks can self-select which group they're interested in participating. So we do have 2 breakouts, one on community support. So this might be a good opportunity to continue to dissect some of those questions, as well as our in-person engagement opportunities planning. So when you do go into the room, we do ask that the group select a note taker who can capture any key points. And I'll ask folks to email their notes to me so we can make sure we capture them. As well as select a reporter that can share highlights during the report back. So John will be facilitating the community supports deep dive, and I'll be facilitating the in-person engagement opportunities breakout room. So just doing a quick high level of the breakout rooms. For the community supports discussion, this is really intended to be an open discussion for folks just to come in to address any questions that you may have on the updated community supports definitions, provide clarity on eligibility, as well as offer additional supports. So when joining this group, if you do have questions that are coming up, encourage you to voice those over. And if we're not able to answer them during the breakout room, we can definitely dig into that to make sure we provide those responses. And for the second breakout room, the in-person and resource fair planning, the purpose of this room is really for us to start to identify any current in-person events or resource fair opportunities that we can use to engage contracted providers to highlight ECM and community support services. For folks that were actively engaged last year with the collaborative, you all may remember we did host a resource fair in Stanislaus County with West Modesto Community Collaborative, and then we also collaborated with San Joaquin Health Centers during the Binational Health Month. So I want to continue some of that momentum this year as we think about how we can collaborate with other organizations that are doing similar efforts so we can bring more providers to the table. So we've listed some of those guiding questions that will flash up on the screen in the breakout rooms. But I think at this point, the rooms should be open, or if not, we will open them and you can self-select which group you would like to join. If you are having issues with getting into one of the breakout rooms, Melissa is going to be helping folks kind of direct them, but you should be able to just click on more and open which breakout room you would like to join. And if not, please let Melissa know. So I will let you all group. We are going to be in breakout rooms for about 15 minutes, and then we'll come back as a large group. So I'll stop my share momentarily so we can move to the breakout rooms.
If anybody needs to be assigned, you can let me know in the chat and I can assign you.
Thanks, everyone. Hopefully we didn't cut off the other group, but we are, oh, I see John shaking his head. So that happens. We're always prepared, but then not prepared. So we're gonna just do a quick 5-minute debrief. So I hope both groups will, I know our group picked our reporter, but wanted to start with the community supports breakout room. If the reporter can share a few high-level updates
Well,
of
we
what.
didn't get a chance to get a reporter because we just dived right into it. I think Shelley from Premier and a couple of other people were just, directly into that. So we didn't get to that. So I'll speak to it. So there was lots of questions in regards to housing deposits and what it could be utilized for. So we had a lot of interest into that. And then at the very end, there was interest in the 6 months transitional rent, what that can be utilized for and how that can be paid in regards to assisting the initial population of focus, which is a behavioral health population of focus first and foremost. And then just to add, Ileana was excellent, like always, in regards to offering the managed care plans perspective regarding housing deposits, and then also talking to them in regards to contracting and understanding the nuances between what they can do in regards to long-term care, recuperative care, and post-hospitalization, 6 months post-hospitalization, and how to contract. So there was a great discussion revolving around that.
Awesome. Sounds like it was really helpful to have that. So I'm glad we were able to create that space. And then Lisa, would you like to report out for our group?
We discussed, this is for our a resource fair. We discussed using our own networking outreach abilities to find out what events are coming up in our communities and reporting back to the collaborative. We wanted to make sure that any resource fairs we provided were accessible. So transportation issues to be considered, also temperature, where it would be held, if it was going to be outdoors, maybe a shady area. consider time of day, people are off work. And then I suggested having a planning committee to kind of have a targeted approach to this so we can report back to the collaboration. So don't think I missed anything. I might have missed a couple things, but those are just a couple of things that I wrote down.
That was great. Yeah, I think we were, just talking through what outreach would look like and what we've seen successful and maybe not as successful in like events that we've participated in the past. So we'll definitely be continuing to work on that and connecting with you all if there are events that are happening that we can collaborate on, similar to how we kind of collaborated with John to bring in more of our providers at the health fairs that they were hosting. So I will share my screen again. I appreciate you all engaging in the breakout rooms and this quick debrief. So we're gonna just move on to some next steps and closing. So for our office hours, we are having, we did push our office hours out. So it was previously scheduled for this Thursday, which is Juneteenth. So we did move it 1 week following. On Thursday, June 26th at 10 a.m., we'll be talking about navigating federal and state budget challenges and just doing some peer solutioning there. And then we always encourage you all to reach out if you would like to schedule one-on-one and want to dive deep into any specific topics or questions that you may have. Please reach out to me at my email, navni@healthbegins.org. Or if you just have any general questions that we could potentially help answer, would love to connect there. We also did want to take a moment. I know we sent this email out last week around the provider survey that UCLA is doing with UC Berkeley around conducting an evaluation of PATH. Providing access and transforming health, which the CPI initiative is underneath PATH, as well as cited NJI and IPP, and the community support initiatives, as well as ECM. So this is a statewide evaluation that UCLA is doing in collaboration with DHCS, and the survey is geared towards learning more about provider experiences in implementing ECM and community support benefits. And experience with PATH and other resources that have been provided by the state or by the Medicaid managed care plans, or the MCPs as we like to refer to them, or the health plans, to support ECM and community supports implementation. So we've linked that survey in the slide deck, as well as sent it out last week, and I'm sure we'll include it in our outreach emails, continuing this as well until it does close. So the survey is going to be open till the end of July, but they did share that if you would like your responses to potentially be included for their fall interim report, that they asked folks complete it by Monday, June 30th. They also shared that they request that for organizations, per organization, you submit one response. So they do have a Google Docs version of the survey if you would like to just go through that with other team members. And if there are questions on this survey, we shared the email that you can contact below, but encourage you all to fill out the survey if you have the time. I know it should not take more than 20 to 30 minutes, and I'm sure the state would value your feedback. So wanted to share that, but with that, I think that is our last slide for today. Really appreciate everyone engaging with us today and our provider spotlights, as well as our breakout room discussions. Hope to see you all at office hours next week. And with that, I will let you all go and hope you have a great rest of your week. Thanks so much, everyone.
Thank you so much. Have a great day.
Bye.
Thank you. Have a great afternoon.
Thank you.
Thank you, everyone.